Studwell, the Oncology Survivorship Coordinator at the Smilow Cancer Care Center at Greenwich Hospital. Thank you for joining us today for our National Cancer Survivorship Celebration and our closing ceremony. We hope you enjoyed all of the survivorship videos that aired throughout the month as much as we enjoyed making them. Today, I'm here with a very talented panel of experts from both the Yale Survivorship Clinic and Smilow Cancer Care Center at Greenwich Hospital. And we're here to answer any and all of your questions regarding surviving cancer. So more people today we know are surviving cancer than ever before. As of January 2019, there are approximately 16.9 million cancer survivors in the United States, which is roughly 5% of our population. That number is projected to increase to 21.7 million by 2026, which is only 6 short years from now. As we know, our cancer survivors can face ongoing physical and emotional issues and treatments that require long-term follow-up and care. Our survivorship programs help you to transition to wellness by providing support services and evidence-based care during and long after your medical treatments end. Survivorship care can begin at diagnosis and extends through treatment and beyond. Some people might ask, why do I need a survivorship program? And the reason is that the following treatments and sometimes during your treatment, you'll continue to have unique healthcare needs. Our survivorship programs specifically provide support for a variety of quality of life issues and concerns that you might encounter throughout your continuum of care. These issues include, but are not limited to, post-surgical pain, neuropathies, fatigue, anxiety, depression, body image issues, lymphedema, relationship issues, and sometimes even just returning to work issues. Our survivorship programs can help meet your needs and help you navigate your needs following your cancer treatments. So now I'd like to introduce our panel of experts who will be answering all of your questions today. One of the things is there is a Q&A button and a chat button. So throughout the webinar, I'll be monitoring the chat so you can put your questions in there and I'll direct all of your questions to whomever they're directed to. So let's start with Jevin Britta. Jevin, would you introduce yourself?
Thanks so much, Heather. And again, yes, as Heather said, I'm Jevin. I'm the physician assistant with the Yale Survivorship Program through Smilow Cancer Hospital. And, you know, I just wanted to take a moment to, again, thank everyone who could join us today, anyone who's going to be watching the recording after. And, you know, really, this whole event has been a celebration of all our cancer survivors, tribute to your journey and allowing for us to be a part of that journey with you. You know, I think cancer survivors, as Heather mentioned, have a unique set of concerns, and we're here to be that support and help empower you to make, you know, healthy lifestyle changes to better your overall quality of life and live the best life that you can. And so we're happy to be there for you however we can. And this was just our way, you know, not being able to do this in person this year for a Survivors Day event of celebrating you. And we hope that you've had a chance to go onto our website, to the Yale Cancer Survivorship website, and view the celebration page, and that you've been able to watch some of the videos that have been posted there from all of us, from our wonderful team, and some of the other videos across our Smilow network celebrating survivors. There are videos on there about exercise, about nutrition, about you know, having your best eyebrows, and mental health and wellness, and dealing with fear of cancer recurrence, just to name a few. And so, you know, we're hopeful that you found some of those helpful, and we're here today to answer your questions that you might have for us, and some questions that we've gotten through email before the event. So with that, I'm gonna pass it along here to Dr. Tara Samft, who's medical director for our survivorship program.
Thank you, Jevin. Thank you, Heather. And thank you to all of our panelists, and welcome to our attendees and anyone who will be seeing this in the future. You know, I just want to say I've got two things. Number one, this would not have happened without the hard work of everyone that you see on the panel today, and specifically Heather and Jevin, who have moved mountains to get this online with their teams. And I really am grateful for their energy that they've put into doing a virtual event like this. Secondly, I just want to acknowledge that, you know, survivorship means different things to different people, and we take care of cancer patients, and, you know, not everyone survives their cancer, and I want to recognize that when we're talking about survivorship. It is important to recognize that not everyone is able to come out of it cancer-free. There are people who are living with cancer and dealing with ongoing treatments and side effects, and they fit into the definition of survivorship as well, because we think it starts at diagnosis. And then, you know, there's a vast majority of people who do live cancer-free for, you know, hopefully a long period of time, and we want to recognize that survivorship comes in all different phases, and it means different things to different people. And I think beyond that word, what we're trying to do is just to say, you know, we're here for you. We at Yale and Smilow Cancer Network believe in taking care of the whole patient. So wherever you are, whatever you're dealing with, we want to be here for you, and that's the spirit of survivorship.
Great, thank you, Dr. Samp. So next on our panel is Dr. Janet Freedman.
Hi, I'm Dr. Janet Freedman. I'm a physiatrist in Greenwich Hospital, and we're the doctors who are specialists in what's called physical medicine and rehabilitation. So we treat any condition that can affect your physical functioning, and that can be a problem with your muscles, nerves, bones, balance, fatigue, etc. So we treat a wide range of people with a wide range of diagnoses using a team approach in the rehabilitation department. In Greenwich, we like to see people at the time of diagnosis if possible, so we can anticipate what physical functioning problems might you have that may cause an issue with your treatment. So maybe you have a pre-existing shoulder problem or a pre-existing neuropathy, and we can try to address that beforehand. And then see you throughout your treatment and afterwards to try to use our approaches to reduce any complications you have and to help you function better. Patients who see me, I can treat pain with injections, with medications, with acupuncture, refer you to physical therapy, occupational therapy, do diagnostic tests that you might need. So we will follow patients for a number of years after treatment's over to address any of those issues that survivors may still have.
Thank you. And next, we'll hear from Maura Harrigan, who is our dietitian today and every day.
Thanks, Heather. Welcome to everyone. And I would just like to thank my fellow dietitians who all opened their kitchens, cleaned their kitchens first, and then opened their kitchens for the videos. So if you haven't had a chance to look at them, they were a labor of love, and it was a lot of fun to do. And, you know, just to underscore the importance of how eating well can really benefit you in many ways. And one, first and foremost, just feeling better, being better fueled. And that's our hope, is that, you know, through these videos that we posted for you, we showed fun ways and easy ways for you to truly nourish your bodies on your journey here. So thanks for being here, and I think I'll pass it on to Scott, if you don't mind, my colleague Scott.
Thanks, Maura. Yeah, I'm Scott Raposa. I'm the physical therapist part of the Smilow Cancer Survivorship Clinic up here in New Haven. I've been here since our clinic opened in 2006, when concept of survivorship care was really just emerging across the country. So so it's been exciting for me to work with this team and to see how survivorship care has grown and has really gained a lot of traction over the years. And as everybody has said previously, yes, survivorship can mean different things to different people, and it can even mean different things to the same person depending on where they are in their life. And so, but one of the things that we try to do that I think we do very well is that we do meet the patients where they are, and to be able to listen to them and see where they are in their lives, and then we can figure out how can we then support them at that particular stage, whether they're 6 months out of treatment, 6 years out of treatment, 16 years out of treatment, whatever it may be. So I look at survivorship as something that's very fluid. I don't think that it's a static phenomenon. And so that's one of the things that our team can do very well, that we can come together and really work with the patient, where they are at that moment. And nobody embodies that better as far as meeting people where they are than our social worker, Angela Caralla. So Angela, I'm going to hand the baton off to you because I know that I feel like I stole your line about meeting the patient where they are. So I apologize for that.
Thanks, Scott. Hi, everybody. As Scott introduced me, thank you. My name is Angela Caralla, and I am the clinical social worker on the Yale Cancer Center Smilow cancer team. And it's an honor and a privilege to be here today, to be speaking with all of you. And just like Scott indicated, I would say that everyone on our multidisciplinary cancer survivorship team really focuses on meeting where the patient is at. And when patients come to our clinic, when you meet with me, it's an opportunity for you to talk about not only how you're doing emotionally, but also the impact that cancer has had and may even still be having on your life. And it's unique in that when you meet with all of the different professionals on our team, you talk about how you're doing emotionally, socially, spiritually, physically, sexually, and all aspects of your life can be impacted by cancer and cancer treatment, as well as you're moving forward in survivorship. And so there's a lot of overlap and crossover among all of us. And so you really do get that holistic approach. And so with that, thank you so much for joining us today. And I believe we have, who's next, everybody?
Lynn.
Lynn, hi Lynn, sorry I couldn't see your title on my screen.
That's okay. Thank you so much, Angela, and thank you to the rest of the panelists. My name is Lynn Carbino, and I'm a nurse coordinator here at Greenwich Smilow. And I've been involved in survivorship care as well as a nurse here at the hospital for a very long time. I truly want to say happy Survivorship Day, month. It is something to celebrate that you're here, that you're thriving, and that you are seeking some more resources, which is exactly why we're here today, to have this virtual closing ceremony so that we can possibly attend to any other questions that you might have out there. My role has always been to meet patients at their diagnosis and to kind of navigate the next steps going forward. But part of my role is to discuss and bring up that survivorship piece, which is, attending to any side effects that you might have lingering past treatment or throughout treatment, psychosocial needs, just making sure that you get the resources, including dietary, nutrition, counseling, exercise, everything. It might even just be referring you back to your oncologist or your medical oncologist or radiation oncologist to get follow-up care. But I can sort of be that liaison between you and the rest of your care team. And with survivorship now, we really do have a multidisciplinary approach to this. And it really has helped a lot of our patients to be involved in our survivorship team and in our survivorship clinics to get those resources and get them started as soon as possible. And I agree with Dr. Sampton and the rest of the team that this, survivorship starts right at diagnosis. I mean, there's so many different steps and stages that you go through from diagnosis and onward. And, you know, thinking about treating your whole body is a big piece of this. And that's your mind, your body, your nutrition, and your family. And this also provides family support as well as you know, caregiver support, family support, as well as support of the patient themselves. So we're here for you, and we want to be able to attend to all of your questions and concerns. Again, just to remind everybody, you can post your questions right here on the town hall meeting that we're having right now through the little question and answer tab at the bottom, or the chat tab. But you can also submit questions ongoing to our Cancer Answers website. And also the yalecancercenter.org will have lots of survivorship information, as well as resources at all the clinics and care centers that we have. So welcome, and please enjoy the next few, I guess it's the next half hour or so, 40 minutes.
Perfect. Thank you, Lynn. All right, so I am actually going to get us going and started already. We have gotten questions that we've gotten from our Cancer Answers email, and we have some live questions as well. So I'm going to dive right in and sort of navigate where the questions are going to go. So my first question is going to go to Dr. Sam. So the question is, I was diagnosed with precancerous cells of my uterus, atypical hyperplasia, currently undergoing hormonal therapy. My question is, statistically, what are my chances of developing cancer? Also, I have CIN stage 3.
Okay, so I guess this is a good question, and thank you for the person submitting it, because it does highlight a little bit of the things that we don't know on this panel today. So we see survivors, and we talk about all these multidisciplinary side effects and management after treatment. As in terms of the risk of cancer development, you know, there are high-risk clinics, and your care provider who's helping you, I think, would be the better person to tell you these the chances that what you have might develop into a cancer. So thank you for being brave and putting that question out there. And I think, you know, what we're hoping to do is answer questions about survivorship. And if you're a person who really needs some very specific medical advice, maybe reaching back out to your provider. And then that's a really fancy, long answer of saying, I don't know. So sometimes we're just not going to maybe know the answer to all the questions, and I'm sorry, but it sounds like you're in really good hands. And again, offline, happy to help navigate any questions about somebody's specific health concerns.
Okay, I thought I'd throw that trick one.
Yeah,
in.
just a softball.
Stage.
Start with the softball. Yeah.
Okay, let's start out with Lynn Carbino. Question came in. I'm wondering if now that I have completed my treatment, is it okay to start dieting? What kind of diet would you recommend?
That's a great question. So I hear this a lot, especially when I meet someone and they're starting treatment. Everybody seems to want to know, what should I be eating? What shouldn't I be eating? What's healthy? What's not? Should I start a keto diet? Should I go sugar-free? You know, does cancer feed sugar? I am definitely not a dietitian or a nutritionist, but my first resource is always to turn to our dietitians and our physicians to ask them about what would be recommended during treatments. I know for a fact that just eating a healthy, nutrient-rich diet with natural fruits and vegetables and lots of protein is usually what's recommended amongst the healthcare providers here. But there might be something specific for your cancer, for your own person. Maybe you have diabetes, maybe you have hypertension, maybe there are things that you should be avoiding. If you have any underlying GI, gastrointestinal disorders, there's a lot that we would want to kind of alter or change or recommend for you that would help you to get through going into survivorship after you're finished with treatment, to get you stronger and to feel well. But again, everybody's individual. There's not one particular diet that works for everyone. And I really think that being referred to a dietitian or nutritionist would be the best thing for you to do going forward. And, you know, there's not one particular diet that I would say works for everyone. And if anyone has anything else to add, especially Maura being in the dietary area, if there's anything you want to add.
we can go straight into a question that's related for Maura.
Okay.
Are there certain foods I should be avoiding to prevent cancer?
Yeah, there are. You know, we do have a good understanding of what it means to eat well, and we know what it means not to eat well, and we know, and we can tweak it to, you know, a person's particular circumstances. You know, there are other illnesses that they're dealing with, but it's clear what we know, what to stay away from are really highly processed foods. So any food that, and not to say these are forbidden, but they just shouldn't be the cornerstone of your diet. They're occasional foods. So things that, as I say, if it's manufactured in a plant and it has an ingredients list that reads like a chemistry exam, those are the foods you have occasionally. All right. So I'm saying I like to have, I like to say to people is, if the food comes from Mother Nature and comes from a plant, those are what you want to eat. But if it was manufactured in a plant, those are the foods you want to limit. And also in terms of highly processed meats, luncheon meats, things that have a lot of nitrates, those we want to limit too. So we want to keep our eating as close to the ground as possible, as much as the way Mother Nature grows it and presents it to us. That's how we really want to eat. And that really addresses a lot of medical concerns, even if you're diabetic, hypertension, have heart disease. In addition to dealing with the cancer diagnosis, that approach to eating really does pretty much cover a lot of bases.
Great, thanks, Maura. I have a question on here for Dr. Freedman. I have pins and needles in my feet. What can I do about it, and how long will it last?
So this sounds like what we call chemotherapy-induced peripheral neuropathy, and that can cause feelings of pins and needles in the feet, in the hands. More serious cases, so to speak, could cause weakness, could cause loss of balance. And in general, this will improve on its own once chemotherapy has stopped over roughly 1 to 2 years. The symptoms generally will reduce. So while you have this, you want to be cautious of a few things. One is to make sure your balance is checked, so you're not at a risk for falling. So you want an evaluation of your balance. You want to protect your feet so you don't have a stone or a pebble in your shoe that could irritate your skin and you don't feel it that well. You want to keep your feet warm and protect them from hard surfaces. So I always recommend well-padded shoes if you're walking, to walk on a spongy running track rather than on the hard sidewalk. And for the symptoms of pins and needles, we can do a few things. There are some medications that can help reduce the symptoms. These are mostly medications in the seizure treatment world, but they actually can work on the pins and needles of neuropathy. Lidocaine patches can be helpful. Acupuncture can be helpful, and time.
Great, thank you. Let's see, is there any coming up here? Perfect. So how about one for, I think this could be Dr. Samf. Do I need to continue to see my oncology team if I am followed by the survivorship clinic?
Great question. And again, speaks to sort of my opening remarks about survivorship sort of being this huge umbrella, right? That starts at diagnosis and extends. In our survivorship clinic, the multidisciplinary team at Yale, New Haven, we see patients in consult. So we see patients as a team. You would see us one-on-one, and then you would come away with a list of recommendations, and we would follow up with you again at least one more time, and the door is always open. That being said, so we don't take on ownership of coordinating that care long-term. We sort of give you the guidance that and answer the questions, and then your regular care team continues on. That being said, there are some long-term survivorship approaches that I think our next steps are to work on consolidating that across our system, where you would be followed annually in like a survivorship program. So stay tuned.
Great. Let's go for Angela. I never used to have a hard time falling or staying asleep. Now 2 to 3 times a week, I have difficulty and find I can't turn my mind off. Why is this happening?
That is an excellent question. And I get asked this question frequently. I think it's pretty common and normal for cancer survivors to have sleep issues. And it could be happening for a variety of reasons. So when I'm meeting with a patient, I will first encourage them to speak to their medical providers about it, to make sure there isn't some underlying physical or medical reason that could be contributing to this. But oftentimes with sleep issues, it's physical and also an emotional component can accompany it. And so, so oftentimes I will talk to patients just about, sleep hygiene, going to bed at a certain time, not having caffeine after about 6, turning off all electronics about an hour before bedtime, and then having a hard time falling and staying asleep, as this participant indicated. If you wake up in the middle of the night and after you've tossed or turned for 10 or 15 minutes, really get up and go read out of an actual book, not on something electronic, or listen to some calming or relaxing music. There are some great apps that are out there through the App Store. One that I like a lot was actually told to me by a cancer survivor herself. It's called I Sleep Easy Free. But all of the apps that are now available, like through Headspace and Calm and 10% Happier, all of them have an aspect that helps with sleep. But if you're not getting adequate sleep, it can be very anxiety provoking. And the more you worry about it, the more you can't fall asleep. And so it can become really a vicious cycle. And so again, talking to your medical providers, but also too, reaching out to a mental health professional or your oncology social worker through the clinic that you see can also be helpful. We also know that exercise, getting in a good routine of exercise and eating healthy also helps with sleep, and learning mindfulness meditation as well. So, thank you.
Thanks, Angela. Okay, next question for Jevin. I think you'd be best to answer this. When survivorship begins is an interesting topic. The medical teams determine that survivorship begins at diagnosis, yet every single survivor that I know never looks at it that way. At a minimum, it's the day that surgery removed the cancer, but more likely we look to when treatment is over and when we can get on with our lives. Why do you think there is such a disconnect?
I think that's a great question, and thank you for sending that in. So, when we think about cancer survivorship, from the point of diagnosis, I think about the definition as defined by Julia Rowland, and she's one of the directors of the Office of Cancer Survivorship at the National Cancer Institute, or NCI. And survivorship is defined as starting at the point of diagnosis. Someone's considered a cancer survivor from the point of diagnosis to the remaining time of his or her life. And so that's where that definition comes from. And that's, when we speak about it, that's what we're thinking of. But I think it is understandable for patients and others to think of survivorship starting at the point of treatment completion. And as a survivorship clinic, that's when we recommend it be the best time for you to come see us after you've completed active treatment with surgery, chemotherapy, and or radiation therapy, or maybe some other treatments, or if you're on a stable long-term treatment. And the reason being is because we think about survivorship in phases and dealing with all the side effects and concerns that go along with the active phase of treatment versus the late and long-term concerns that happen after treatment. And that's where, as a survivorship clinic, we thrive in being able to help you. So I hope that answers your question, and that was a good one.
Great. I think also too, just to add to that, having the improvements in cancer treatments, survivorship is really a new area of someone's cancer journey. So we've taken a lot of time to really focus on, are there any problems that we might find that we can attack during your treatments and so that you don't have to wait until you're done. So if you have, you know, I don't know, neck pain or back pain because you had to stay in a position in your radiation treatment every day for a month, you know, do you have to wait until you're done with your treatment, or can we work on some of that while you're getting treatment? So I think survivorship in general is just a newer department or continuum process that is going to evolve. So I think that's why there is such a disconnect, but it's evolving, it's getting better.
You know, historically, they used to, the term used to be cancer victim a long time ago. And that, for obvious reasons, did not sit well with people. And so the word survivorship was meant to replace that. And, you know, I think we're going to see iterations of this as time goes on, because it's clear that it certainly doesn't speak to all the things, like our person who put the question in. There is some disconnect, but we're trying hard to kind of describe what we're doing, which again is hopefully taking care of the whole patient.
Let's go to another question. As cancer survivors, and I think Dr. Samp, you can chime in on this one. As cancer survivors, do you think we should be considering ourselves as immunocompromised or high risk regarding COVID-19 exposures?
Yeah, wow, this crowd, man, mighty crowd today. Great questions. So as survivors, are you considered immunocompromised in the world of COVID? So technically, the best data that we have, I think the longest data, right, comes out of China, in the longest time of exposure. And there is some suggestion that any person with a history of cancer is at higher risk for contracting COVID, and if they were to contract it, a higher risk of complications. Now, where in that spectrum any one person is very difficult to say. And, you know, we're learning new things about COVID every single day. So I think by and large, it's a conversation between you and your doctor. What is my individual risk? Why do you think that? And what should I be doing about it? And we all should be taking proper precautions, including wearing masks in public, social distancing, washing hands, being smart. So, I think technically this group is a special group. We're still learning about it, and we have to be very careful and cautious, but also not so fearful that we're not willing to do anything. And so I don't know if that got to the heart of it, but it's certainly something to talk about with your care team. And I'm having these conversations multiple times a day with my own patients.
Great, thank you. So sticking with, we have two other COVID questions that have come in. So this one for Scott, is it safe to exercise outside during COVID-19?
Yeah, that's a great question. And I would answer that, again, it kind of depends on the situation. What I would say is that, you know, if you're outside, you know, and you're going for a walk in your neighborhood and, you know, there aren't a lot of people around, then yes, I would say that it's safe to exercise outside. And honestly, that may be, you know, our greatest option for exercising at this point, because whether, you know, a lot of the gyms are still closed, or even if the gyms do start to open, what is your comfort level in going back to a gym? So, you know, fortunately, you know, here in America, you know, it's summertime, and so it's warmer, so it's better to get outside. I would suggest getting out earlier in the day before other people get out and about, before the heat really picks up. And when it comes to some of those public spaces, you know, whether it's a town park or a state park, hiking trails, biking trails, you know, I think, you know, during the week, as people have gone back to work, there are fewer crowds, so I think you're probably safe there. On the weekends, those spaces are probably going to be more crowded, and so, you know, if you are going to go for a hike, you know, maybe you do want to have your mask on with you while you're doing that. To, you know, just to err on the side of caution and to take care of yourself. But I even have you know, friends and patients who have said that, you know, they will exercise in their backyard, or they'll exercise in their front yard. They'll take the yoga mat and they'll set it up in the front yard, and they'll do their yoga routine out on the front yard. So there's lots of different options there. So yes, I would say that definitely during this time of year, this is a good time to get outside and exercise. And if you have the question of should I be wearing a mask or not, then I would say err on the side of caution and say yes.
Great, thank you. And another COVID question that came in for Maura: can I get COVID-19 from my takeout food?
Great question. So from takeout food, I guess, well, the answer is no. Now remember, it's not transmitted via food, all right? So the food is not contaminated. The biggest danger are the people who are working with the food, all right? So in terms of takeout, I think you really have to kind of judge the place. Are the workers following the precautions? Are they wearing masks? Are they wearing gloves? Is it a clean place? I would want to know where the place is that I'm getting the takeout from. I do get asked that. I don't feel that there's a chance of it being transmitted on the containers. Again, once, as long as you try to keep everything as minimal contact as possible, right? And when you receive the items, you bring it into your home, you wash your hands before you eat it. Those are kind of straightforward precautions. The greatest risk are the people working with the food. The same with food shopping. People ask me, how safe is it to go food shopping? Again, you have to follow the guidelines: wearing a mask, wiping down the surface and the handles of the cart or the basket. The problem's not the food. The problem is the other people in the store, keeping a social distance. And when you come home, first thing, washing your hands, and practicing good food safety in terms of how you store the food and how you handle the food. So hope that answers the question.
Great. So we have one that popped up for Scott. Related to that question about outdoor exercise, my gym reopened and I just began some indoor exercise classes. It's the YMCA. I'm going with my gut and staying away, but interested in your thoughts.
Yeah, when it comes to this situation, again, as Dr. Samp was saying earlier, we're learning new things about COVID every day. This is still a new condition, in relation to other conditions that we are dealing with. So if your gut is saying to stay away, I would trust to your gut. I would say that, as gyms do start to open, for anybody who does have gym memberships, for anybody that was going to the gym pre-COVID-19, you're the consumer. And so you should absolutely be asking the questions, before you go back to the gym. Are your exercise bikes 6-8 feet apart? What are you doing to wipe down, the exercise equipment? Because if you have a membership there, you're the consumer. So it's within your right to ask these questions. And maybe, again, as the consumer, maybe you make suggestions. You just say, maybe can you bring the exercise bikes outside and put them under a tent or something like that. So I would trust your gut on that. And again, look at other options, for exercising outside. Maybe this becomes an opportunity to buy your own bike, or to get that pair of running shoes that you really wanted, and or a nice new pair of hiking shoes. Connecticut has such great open spaces, that you can explore, and so these are you can get a good workout in, even by doing some short hikes and that sort of thing, if you've got a backpack with some weight on it. But yeah, I would if you're having reservation, I would say at this point still, to be safe, trust your gut.
Great. Okay, Dr. Freedman, we have one for you here. Why do my joints and muscles hurt? My doctor says it's from my hormone therapy. And then there's a second part of the question, which is, who can help me?
Okay, so Definitely, hormone therapy or aromatase inhibitors are known to cause joint pain as a side effect in a fair number of patients. And the good news is this also wears off often in about a year. But if it's significant and interfering with life, you can do a few things. You can talk with your medical oncologist, possibly take a month break from the medication and then start a different one. That's sometimes done and is sometimes helpful. And then in physical medicine, we can help you in a variety of ways. If it's a problem in, for example, fingers, thumbs, wrists, you might be helped with some splinting that can rest and protect that joint. And exercise, we have learned, is a great fix for this kind of joint pain. It might seem counterintuitive to exercise when your joints hurt, but in reality, with the effect of hormone therapy, people will have reduced joint pain with exercise. Exercise in water is great. We have some limitations, as Scott's been talking about, with a lot of people to get access to water. But if you have your own pool or you have a pool that is now by appointment, etc., just doing some simple walking in water, don't have to get your head in the water, just to give your joints some time with less gravity and movement. So for who can help you, we can help you in physical medicine, reduce or overcome a lot of those side effects.
Great, thank you. And Angela, we have another one up for you.
Okay.
I never used to cry or be emotional. Now that treatment has ended, I find that I cry often for no reason. Why is this happening?
Okay. That is a really good question. And it is something that often survivors will talk to me about. When I'm meeting with a survivor, they'll say, you know, I went through chemo and surgery and radiation and I was strong and I didn't cry. I was a trooper. I was stoic. I beat this. And now that treatment and everything has ended, I find that I'm crying. I turn on the television and there's a commercial or a movie, or I hear about a family member or a friend getting diagnosed and I just start to cry, or I'll just be walking through the grocery store like the participant just indicated, and I just start to cry for no reason. And the best way that I can try to make sense of this is that when you're going through cancer and cancer treatment, you're dealing with the physical aspects of cancer, right? The side effects, the healing, the recovery. And I think often what happens is your brain can only manage and handle so much. And once the physical stuff starts to settle down, once you've gotten through treatment, gotten through healing and recovery of surgery, and are now moving beyond that, that emotional part starts to creep up. And that's when you really start to think about and process what it is that you've been through and the impact that it has had and even it's still having on your life. And so, again, that emotional part, it's really not uncommon for survivors to have some anxiety, some depression, even some PTSD as a result of what you've been through. And so I would encourage you, again, you know, to reach out to support. Sometimes going to a support group can be helpful, talking to your medical providers, talking to a clinical social worker at the cancer center where you were treated, or even maybe getting some support through a mental health professional in the community. But sometimes that can really be helpful, just to work through and process the thoughts and feelings that you have. So hopefully that's helpful.
Very helpful, thank you. It's a question for Dr. Sam. What do I do about concerning symptoms? Who do I report these to? My PCP, my oncologist, or another doctor? What symptoms should I be looking for? I'm a survivor.
Okay, yeah, that's a good question. So in general, what we talk about in survivorship, regardless of your type of cancer that you've had, is if you get a symptom that is persistent, progressive, and unrelenting after 7 to 10 days. So little things that kind of come and go typically aren't concerning for recurrence, but you know, I have a new pain and it's been there and it's getting worse and now I'm up at night with it. That's a reason to be concerned. And I use that just as a broad example, but you know, any symptom that is progressive and persistent and, you know, in that, beyond that like week to 7 day period. I think the most important person to call is your cancer doctor. And the reason for that is that person understands the likelihood that this would be cancer or not, because cancer is all we think about all day, every day. You certainly can work, through your PCP as well, and they're, there for you and able to help work it out. But in our minds, the most important thing is to make sure it isn't a cancer recurrence. And so cancer doctors are just wired to think about that. I hope that helps.
Question for Lynn. Is there anything I can do to make my hair grow back faster after chemotherapy?
Oh, that's such a great question. I hear that all the time. And I wish there was some magic miracle that will make it go faster. But what we do recommend, and what I've seen a lot of the oncologists and support people recommend, is just making sure that you're having and eating a healthy diet. A multivitamin, sometimes B complex can help. But really, it's just a matter of time that will help to let those hair follicles come back. I actually, when I meet patients in the very beginning, before they've had treatment or even lost their hair, we talk a lot about different resources, including cold cap therapy and using wigs and head coverings and things like that. But when I do talk to them about chemotherapy and the effects on the hair follicles, I really kind of reinforce the fact that that hair grows back. It really does. It's pretty rare that we have patients who lose their hair and it's gone forever. I mean, that's a really small percentage of patients. We really do see sometimes even during treatment, before you're even completed with treatment, hair starts to grow back. So it's pretty amazing how quick it comes back. But there is unfortunately no miracle to make it come back faster. Just a good healthy diet and just, give it some time and some patience, unfortunately. But it can come back, and it can come back in a different way. It can be thick when it was thin before. It can be curly. It's pretty amazing.
Thank you. I have a question for Jevin about survivorship. Is a survivorship clinic visit like a support group? Is it with others? Can I come back for more visits?
Yeah, that's a great question. And it's something that we get asked about a lot and is misconceived often. So for our clinic, through Smilow and New Haven and the other locations we go to, as a multidisciplinary clinic, you meet with each one of us one-on-one. And that includes myself or Dr. Sanft, that includes Angela, that includes Scott, and that includes Maura. You get all 4 disciplines weighing in on concerns that you have. And it's a one-on-one visit. And I believe Dr. Sanft referred to this earlier too. But it is not the equivalent of a support group. Other patients do come in to see us too, but it is just between you and each of us 4 providers. And you are welcome back. We actually schedule an 8-week follow-up for you to come see us again to follow up on concerns you might have had that day, see how those concerns maybe have changed, or to follow up on the recommendations. And then you're always welcome back. As Dr. Sanft alluded to before, there's an open door policy that we have. We have people who come and see us right after they finish active treatment. And then we have people who come years down the road. I think before I started in the clinic, there was a survivor who came 30 years after he had completed treatment. So you're always welcome.
Great, thank you. Lynn, we have another one for you that has popped up here. I watched the eyebrow video. My eyebrows were sparse before, and even more so now. Do you recommend a certain kind?
That's a great question. I don't recommend any certain kind. I think that with eyebrows, it's a little bit different than the hair on your head. They do grow at a different pace. And some, are sparse as we get older as well. So it's a little difficult to know how they're going to come back, if they do come back. But what's great is that we do have lots of different tips and tricks to be able to stencil in eyebrows, color them in, They have lots of tools out there now that can help to make that a lot easier than it was before. And so, you know, obviously I would say talk to your either your navigator or your support groups that you have near you to talk about resources that are local and close by. And, you know, you can get referred to lots of different places to help with eyebrows and eyelashes, because those tend to be the ones that people get a little bit more distressed about when they disappear. So, so I would definitely, you know, speak with somebody in your area, and we can get you some referrals to help add some eyebrows in.
And we have, I think in the video, we had a variety of different products, and they were, Heidi did one that was more of a powder that she used with a stencil. And then there was one that was more liquid, like a mascara, and she did one on one eye and a liquid on the other eye, and they actually looked identical. So I think now, being a person who's actually using those products, I'd say they're both great. The eyebrow that goes on like a mascara, the stencil pencil that goes in there,
yeah, the mascara tends to actually thicken what you have there and fill in the areas. So that really is quite a great product.
Yeah, and it goes on quick and easy.
Yeah.
It dries fast. So
yeah,
it's a great question. Oops, sorry. Okay. So Dr. Freedman, we have another question for you. I had 3 lymph nodes removed after my breast surgery. When can I fly, and can I go in a hot tub?
Okay, great question. And these are 2 areas that have really, our thoughts about them have changed in the past few years. So you're asking, I believe, specifically about the concern of bringing on lymphedema or making lymphedema worse. So lymphedema is a condition of swelling that you may get after having lymph nodes removed, and fluid that will normally flow through the lymph system will back up somewhat. And there are some things that put you at a greater risk for lymphedema, and some things that we used to believe put you at a risk for lymphedema, but probably don't. So flying in an airplane, if you've had lymph nodes removed from the armpit area, we now really don't believe is a risk for causing lymphedema. For many years, we said don't fly or wear a compression sleeve. And now with a lot of studies done in this country and in Europe, we don't feel it's really a risk. If you have had a large number of lymph nodes removed, or you already have lymphedema, it's prudent to wear a compression sleeve, but I believe that if you don't have lymphedema, it's really not necessary. Now the leg is a different question, and people who do have swelling in their leg for any reason should wear compression stockings in an airplane. But I don't believe there's a time limit to flying. We're not really flying now, but once we fly again, generally once you've recovered from your treatment, you can ask your oncologist about being around other people, you can fly. Now a hot tub is another issue, and hot tubs we now believe really do increase risk for lymphedema. So sadly, I'm telling my patients, no hot tubs, no jacuzzis, because that heat will bring a lot of fluid out of your bloodstream into your tissues, and your body may have a greater difficulty of resorbing it back in. So flying, yes, hot tub, no.
Great, thank you. We have time for 2 more questions, I think. We're getting close to our 1 o'clock ending time. So Maura, does sugar feed cancer?
Give you the short answer, no. Just clear that up right away. I could end it there, but I'll give you a little explanation. The thing is, this is a common myth, and it's really a misinterpretation of the science, and it causes so much stress to people that they feel guilty when they eat something sweet. You know, they'll say like, I just had to have that Snickers bar, and I ate it, and then they start crying. Like, and you know, and I know that sugar is going to cause my cancer to come back. It can be so distressing to people. Many tears in my office over this issue, but also many tears of relief when I tell them there's not that connection. and it's freeing. And they go, really? I was like, yeah, you can enjoy those foods. It's not going to cause your cancer to come back. However, there is such a thing as eating too much of that stuff, just in overall health. And they're like, oh yeah, I get that. I get that. And one of the places you have to look at are things you do every day, things that you drink in particular. So you look at your coffee habit, or your, yeah, I know Angela's shaking her head, or your Starbucks habit. I love teasing Angela about that. So, you know, Starbucks can be a pretty strong vehicle for a lot of sugar and a lot of fat. But look at what you're drinking on a daily basis, and look at the sugar content, because that's just for overall health, and particularly heart health. But in terms of that direct connection between having something sweet to eat and causing cancer, no, be free of that and enjoy it. And I'll leave it there. I want you to leave on a positive note with that.
Great. Okay, we have time for one more question. We have so many great questions, and I think in the end we will post sort of a script of these questions and answers onto our website, and our website will also be in the chat room at the end, so you can copy that down, take it, and then follow back up on our website. So Scott, I'm going to give the last question to you. It is, I'm still really tired from my treatments. Is that normal? And what can I do?
Yeah, so unfortunately, that is probably the most common physical symptom that we see in our cancer survivors, is this phenomenon called cancer-related fatigue. And it's really, it can be caused by really the perfect storm of the patient going through surgery and chemotherapy and radiation therapy, or any combination of all those treatments. You know, the body gets beat up with all of these treatments. And so it is common, and a lot of times this cancer-related fatigue can last for years after ending treatment. And I think that's one of that can be a very distressing thing, is that you know, I finished treatment 6 months ago, but I'm still tired and I don't understand why. And again, it's the most common physical symptom that we see. And so our approach through rehab and through exercise medicine is to systematically rebuild your cardiovascular system. You know, the most current recommendations for exercise are to build up to 3 times 30 minutes, ideally 5 times 30 minutes a week. But if you haven't been exercising at all during your treatments, we don't expect that to happen overnight. So in working, you know, with a rehab specialist in oncology, we're going to take you through this systematically and slowly and build up that endurance again. You know, first and foremost cardiovascularly, but also rebuilding strength as well, and doing it safely so that you feel stronger. And by creating this new cycle, right, of getting out of the cycle of fatigue and creating this new cycle of exercise. A little bit of exercise makes you feel a little bit better. And if you feel a little bit better, then you feel like exercising a little bit more. So you create this new cycle of exercising. And that's really, you know, if I'm hitting cleanup here, I think that's one of the things we want to leave you with. You know, all of our teams through the Smilow Care Network here, especially our survivorship network here, you know, we want you to make these sustainable changes, you know, life modifications moving forward, and we're here to support you to be able to do that every step of the way.
Great, thanks, Scott. So Jevin, do you want to close us out for the event?
Sure. Thanks, Heather, and thanks everyone for joining us today. First and foremost, to all of our attendees, you know, all of you survivors, anyone who knows a survivor out there. You know, we hope you found this fun, informative, and you learned a little bit of something along the way over this month. Again, Heather has posted the website in the chat, so you can go there for the virtual celebration page where all of this, including this recording of today's closing ceremony, will live, and all the wonderful content we've posted up there from across the Smilow network and from within our own team. And, you know, next, I really want to thank everyone here. This wouldn't be possible without all of you posting all of that content, taking the time and dedicating yourself to cancer survivorship. and, you know, being there for all of our wonderful survivors. And then also to everyone who's not here, you know, right now, who has also helped us along the way. I know Emily Montemerlot is on the call, Renee Gaudet, Dr. Charlie Fuchs, who's the director of Smilow Cancer Hospital. You know, everyone who's been involved every step of the way here in helping us. Really a big shout out to all of you. And again, we hope you got something from this, and we were happy you shared this hour with us. So thank you. And
Great.
happy
Thank you,
Cancer
everyone.
Survivors Day,
Happy
everyone.
Happy
Survivors Day.
Survivors Day. Bye.
Thank you.
Thank
Happy
you.
National Survivorship Day, virtual. Bye-bye.
Bye.
Bye.
Hi, everybody. Be well.